for tumours, you can use it for cysts. I met a lady who told me she'd conquered her breast cancer by castor oil, wearing the castor oil compresses. In fact, one young girl I knew had a fibroid in her uterus. They wanted to operate, but she wanted to do it naturally. So she took the anise wild, or applied the anise wild yam cream to get the estrogen down, and applied the castor oil compresses to her abdomen. Some people sleep with them. You can certainly have it on overnight. Some people would rather be a little bit freer at night and just let it sit in their clothes. But you need to have a plastic backing, because the castor oil could soil the clothes, but done properly it will never soil.
More than 70% of people over 60 are dealing with chronic inflammation that quietly damages their joints, blood flow, and ability to move comfortably. The worst part is that many don't even realize it's happening. There's a thick natural oil that people relied on for generations before modern treatments pushed it into the background, and it can begin working beneath the skin in as little as 2 hours. Picture yourself getting out of bed tomorrow without that familiar stiffness in your joints. Imagine your ankles looking less swollen and feeling lighter, and actually wanting to go for a walk again. I've ranked 10 benefits of this oil from the least impressive to the most powerful, so you can see exactly where it makes the biggest difference. And the number one benefit, clinical observations showed it reduced visible joint swelling by as much as 57% without taking a single pill. Maybe right now you're avoiding stairs, cutting back on walks, or noticing your fingers becoming less flexible with each passing year. But in just a few days, that situation could begin to improve. Chances are this oil is already somewhere in your home, yet most people never use it correctly. What you're about to learn challenges much of the conventional advice people hear about managing pain and stiffness after age 60. By the end of this video, you'll understand why your joints kept declining despite trying creams, medications, and exercise routines. After age 60, the body's natural anti-inflammatory activity drops by almost 40%. That's a huge change. One of the key players involved is a molecule called prostaglandin E2. Think of it as a built-in communication system that tells your joints when to repair themselves and when inflammation should calm down. When levels drop, joints become stiff, swollen, and less flexible. Blood flow also becomes less efficient at clearing away damaged material. This goes far beyond waking up with sore knees. When your body's inflammatory control system starts breaking down, a chain reaction begins. Healthy blood circulation struggles to reach tissues. Extra fluid gathers in the ankles and feet. Calcium starts collecting in places where it shouldn't. At the same time, a process known as silent microcalcification develops inside inflamed joints and blood vessels. You can't see it. You usually can't feel it. But it's there, gradually building up day after day. Most doctors recommend anti-inflammatory medications, stretching routines, or compression socks. Those approaches can provide some relief, but they mainly target symptoms. They don't solve the deeper issue, your body's declining ability to control inflammation and clear calcification naturally. The good news is that this process isn't permanent. It can be improved. When your skin absorbs ricinoleic acid, a fatty acid found in castor oil, your body converts it into anti-inflammatory prostaglandins. Research has examined this process in hundreds of studies. As those prostaglandins reach the surrounding tissues, joints can begin feeling looser and more comfortable within hours. Medical professionals refer to this process as transdermal cytokine modulation, which means calming inflammatory signals directly where they're occurring. It's similar to reducing a raging fire down to a small flame. In some cases, localized swelling can decrease by 30% to 45% within a week. People often notice less morning stiffness, lighter feeling legs, and reduced throbbing in their fingers and knuckles. Over time, additional changes may follow. Excess fluid begins to drain, calcium buildup softens, and concerns about losing mobility become less overwhelming. Of course, not every castor oil method works equally well. Some techniques promoted online are ineffective. Others can cause side effects that people rarely mention. A few approaches, however, can make a major difference while costing very little. After spending 6 months reviewing available research and speaking with rheumatologists and vascular specialists, I've ranked 10 benefits from lowest impact to highest impact. Let's begin with the ones that offer the smallest improvements. For many people, this is the first thing that comes to mind when they hear about castor oil. The common claim is simple: apply it to age spots and skin tags, and they'll gradually fade. There is some truth to that. Ricinoleic acid helps support skin cell turnover, and a 2024 dermatology review reported about an 8% improvement in hyperpigmentation after 6 weeks. But let's put that into perspective. 8% after 6 weeks of daily application isn't a dramatic change. Most people would struggle to notice a difference without looking closely. The oil works by penetrating the outer skin layer and helping replace damaged cells that contain excess pigment. In other words, it helps maintain skin quality rather than erase years of accumulated sun damage. It's like preventing paint from peeling rather than repainting an entire house. If you're over 60, there's another point to remember. Aging skin is thinner and more fragile. Never scrub castor oil off aggressively. Use warm water, a soft cloth, and gentle pressure. Avoid pulling at skin tags or scratching them. That's one of the easiest ways to create irritation or infection. This benefit provides useful skin support, but it's unlikely to produce dramatic cosmetic changes. Score 2 out of 10. Helpful but limited. Beauty influencers often credit castor oil for thicker eyebrows and longer eyelashes. There is some science behind that claim. Castor oil contains ricinoleic acid along with omega-6 fatty acids that help nourish hair follicles. However, expectations should stay realistic. A study published in the Journal of Cosmetic Science found that hair strand thickness improved by around 12%, but only after nightly use for 4 consecutive months. That's a long commitment for a relatively modest improvement. And if hair follicles have become inactive due to age-related hormonal changes, no oil can bring them back. Castor oil can strengthen and support existing growth, but it can't restore follicles that have stopped functioning. Many people also make a common mistake when applying it. They coat their lashes heavily right before bed, allowing the oil to move into their eyes during the night. The result is often irritation and blurry vision the next morning. If you decide to try it, use a clean mascara wand and apply only a thin layer along the lash line. It's also best to apply it about 2 hours before going to sleep so the oil has time to absorb. Score 3 out of 10, some benefit, but the results take time and remain fairly modest. Ricinoleic acid contains antimicrobial compounds that help fight the bacteria linked to gingivitis and inflammation of the gums. A 2023 study published in the Indian Journal of Dental Research found that castor oil mouth rinses lowered markers of gum inflammation by 18% after 6 weeks. The oil seeps into soft gum tissue and helps break apart bacterial biofilm, the sticky layer of bacteria that brushing alone often fails to remove. The downside? Swishing castor oil is unpleasant. Its bitter taste is strong enough that many people stop within a few days. For those with dentures or dental bridges, oil pulling may weaken adhesives and affect the fit of dental work. That can lead to expensive repairs. Swallowing too much castor oil can also cause intense stomach cramps and diarrhea. If you decide to try it, combine half a teaspoon of castor oil with coconut oil. Swish gently for 5 minutes, then spit it out completely. Do not swallow it. Score 4 out of 10. It can help, but the drawbacks are significant. This benefit ranks above the previous 3 because it goes beyond skin level effects. When applied to swollen legs, castor oil may help support the lymphatic vessels beneath the surface. After age 60, the body's ability to move excess fluid becomes much less efficient. One vascular health study found that regular castor oil massage reduced visible swelling in the legs by 22% over a 4-week period. The technique is important. Don't simply rub the oil on randomly. Massage upward, moving from the ankle toward the knee. This follows the natural direction of lymphatic drainage and encourages trapped fluid to move back into circulation. For added support, some people mix in 3 drops of cypress or ginger essential oil. A major safety concern should not be ignored. Oily feet and floors can create a serious slipping risk. For adults over 60, a fall can lead to a broken hip and months of recovery. Apply the oil while seated and put on non-slip socks before standing up. The results can be helpful for edema and varicose veins, although the monthly cost is roughly $14. More effective uses of castor oil appear later on this list. Score 5 out of 10, helpful, but it takes consistency and care. When castor oil is applied to a stiff joint, it does more than sit on the surface. It is known for penetrating through several layers of tissue, moving beyond the skin and muscle toward deeper structures. Ricinoleic acid appears to do this more effectively than many other natural oils. Research published in Phytotherapy Research reported that heated castor oil packs reduced markers linked to joint calcification by 26% after 8 weeks. Participants also reported improved mobility within the first 2 days. Fingers felt less restricted, knees moved more freely. The process is simple. Saturate a flannel cloth with castor oil and place it over the affected joint. Cover it with plastic wrap, then apply a heating pad on a medium setting for 45 minutes. Heat helps the oil reach deeper areas where calcium deposits may have accumulated over time. Avoid heating the cloth in a microwave. Uneven temperatures can cause burns, especially on aging skin. People taking blood-thinning medications should consult their doctor before trying this approach because substances absorbed through the skin may enter circulation. Score 6 out of 10. Very useful when used correctly. As ricinoleic acid absorbs through the skin of the abdomen, it may activate the parasympathetic nervous system. This is the part of the body responsible for rest, digestion, and recovery. In simple terms, it helps shift the body away from stress mode and toward recovery mode. A study published in the Journal of Naturopathic Medicine found that nightly abdominal castor oil packs improve sleep quality by 28% within 2 weeks. Participants fell asleep more quickly, woke up less often, and reported feeling more refreshed in the morning. Those frustrating 3 a.m. awakenings became less common, and racing thoughts seemed easier to manage. The routine is simple. Rub 1 tablespoon of castor oil onto the abdomen using clockwise motions. Cover the area with an old t-shirt about 30 minutes before bedtime. The biggest downside is that castor oil permanently stains fabric. Use older sheets, clothing, and a towel underneath your torso to protect bedding. Score 7 out of 10. Strong results, but it works best with daily use. This benefit doesn't get enough attention. Healthy circulation depends on blood vessels staying flexible. After age 60, vessels tend to become less elastic. Blood can collect in the lower extremities, circulation slows, and symptoms such as cold hands, numb feet, and heavy legs become more common. Ricinoleic acid may stimulate prostaglandin receptors involved in blood vessel relaxation. A study in the Journal of Ethnopharmacology found that castor oil applied through the skin improved peripheral circulation by 33%. Many users report warmer hands and feet within hours. Tingling sensations decrease, numbness becomes less noticeable. Skin color may also improve as circulation increases. A 16-ounce bottle of cold-pressed, hexane-free castor oil costs about $8 and typically lasts 6 weeks, making each application cost less than 20 cents. Apply it nightly to the abdomen and the soles of the feet, then put on grip socks right away. Anyone taking warfarin or other blood-thinning medication should speak with their doctor first, because topical castor oil may increase anticoagulant activity. Score 8 out of 10, affordable, fast-acting, and highly useful. Many older generations kept castor oil in their medicine cabinets for a reason. While it was often dismissed as an old-fashioned remedy, research suggests it can be effective for constipation and slow digestion. When a small amount is consumed, ricinoleic acid is converted in the small intestine into a substance that activates EP3 receptors along the intestinal wall. This starts peristalsis, the wave-like muscle contractions that move waste through the digestive tract. The effect is not subtle. It can produce a noticeable reset of bowel function. Clinical trials published in Complementary Therapies in Clinical Practice found that oral castor oil reduced constipation severity by 37% and improved bowel movement frequency within 24 hours. A common approach is mixing 1 teaspoon of food-grade castor oil into warm lemon water and drinking it on an empty stomach in the morning. First-time users should begin with only half a teaspoon to see how their body responds. Never take more than 1 tablespoon. Larger amounts can cause severe cramping, diarrhea, and dehydration, especially in adults over 60, whose electrolyte balance may already be more sensitive. If improving digestion is your goal, the unpleasant taste may be worth tolerating. Score 8.5 out of 10. Extremely effective when used responsibly. Castor oil is one of the richest natural sources of ricinoleic acid available. Most topical creams only contain around 2 to 5% active anti-inflammatory compounds. Cold-pressed castor oil, on the other hand, is about 90% ricinoleic acid. That difference matters. When you place a castor oil pack over an inflamed joint and add gentle heat, the oil works through the skin and into the area around the joint, reaching the synovial fluid. This is the fluid that helps joints move smoothly and reduces friction. A study published in Phytotherapy Research reported that castor oil packs led to a 42% drop in arthritis pain scores and noticeable improvement in joint movement within 3 weeks. The method is simple. Soak a wool flannel cloth in castor oil, fold it into 4 layers, place it over the painful joint, wrap it in plastic, add a heating pad on top for about 1 hour. Do this around 5 nights per week. In the first week, morning stiffness often drops from hours to just a few minutes. After a month, swelling can reduce noticeably in some cases. The main drawback is time. Not everyone can commit to an hour every night, but with consistency, it can outperform many over-the-counter anti-inflammatory drugs without the stomach side effects. Score 9 out of 10. Very strong support option. The liver works as the body's main filter. It processes toxins, waste products, and inflammatory compounds. The lymphatic system moves those materials toward the liver for removal. With age, both systems tend to slow down. Waste starts to build up, and inflammation can rise in the body. This is often linked to joint discomfort, swelling, low energy, and sluggish digestion. Castor oil packs placed over the liver area, right side just under the rib cage, are used to deliver ricinoleic acid through the skin. Once absorbed, the body converts it into compounds linked with lymph movement and liver activity. A study in the Journal of Naturopathic Medicine found that daily castor oil liver packs for 30 days increased lymphocyte levels by about 28%. Other findings showed lower inflammation markers and better liver enzyme balance. Many people report early changes within days. Some notice less puffiness around the face. Within a couple of weeks, energy levels and digestion may feel steadier. Over time, that heavy, sluggish feeling some people describe can reduce. Score 10 out of 10. This is the main focus. How to use it. Soak a wool flannel cloth in cold-pressed castor oil until fully wet but not dripping. Place it over the right side of the abdomen under the rib cage. Cover with plastic wrap. Place a heating pad on medium heat for 45 to 60 minutes before bed. Nighttime is often used because the body is naturally active in repair and processing functions during rest. Use only cold-pressed, hexane-free castor oil in a glass bottle. Reuse the same cloth multiple times and store it in a sealed glass container in the fridge between uses. Some people may feel mild nausea or a light headache in the beginning. This is sometimes reported as the body adjusts. It usually fades quickly. Anyone on blood-thinning medication or with clotting issues should speak with a healthcare professional before trying it. Start with 1 liver pack per day for 30 days. Some people also combine it with gentle leg massage or joint packs depending on their main concern. Common mistakes include cutting sessions short, using it right after large meals, or expecting immediate results in just a few days. Changes usually take a few weeks of steady use. The main idea behind this method is simple. Support the body's natural processes instead of forcing quick fixes. The liver and lymph system already handle waste removal. This approach is about giving them external support. Stay consistent for 30 days. Track how your body feels each day in a few lines and compare your first entry with your last. Thanks for watching, and I will see you in the next video.